Shocking! Nearly 1 in 4 doctors work over 48 hours weekly. Did you know that nearly 1 in 4 doctors in Ireland work over 48 hours per week? This statistic from the Medical Council's latest research not only highlights the grueling hours our medical professionals face, but also sheds light on the impact this has on patient care. But here's where it gets controversial. The research found that almost 3/4, 73% of doctors cite pressure on workloads as the primary barrier to providing sufficient care. Imagine being a doctor, knowing you might not have enough time to give your patients the attention they deserve. It's a sobering thought. The most affected specialties? Surgery, 50.9% of surgeons, and obstetrics and gynecology, 34.9% of OBGYNs, reported the highest rates of working over 48 hours a week. These figures are staggering when you consider the European Working Time Directive, EWTD, limits doctors to 48 hours per week. But what about patient care? Over a quarter, 26.1% of doctors admitted difficulty in providing sufficient care at least once a week, with pressure on workloads being the top reported barrier. It's a vicious cycle. The more doctors work, the less time they have to provide quality care. And this is the part most people miss. Doctors are human, and the constant pressure can lead to burnout. In fact, more than 17% of doctors are considering reducing their clinical hours. That's a wake-up call for healthcare systems worldwide. As Ireland's population continues to grow, the demand for healthcare services is skyrocketing. The Medical Council is working with various stakeholders to address these issues. But is it enough? With over 30,000 doctors on the register, why are only 20,692 actively practicing? And what about the increasing number of international graduates, many from Pakistan and Sudan? This is not just a matter of numbers. It's about the quality of care patients receive and the well-being of our doctors. What do you think? Is the current system sustainable, or do we need a complete overhaul? Share your thoughts in the comments below. Let's work together to ensure that our healthcare system supports both patients and doctors. The future of medicine depends on it. Dr. Overwork in Ireland. Concerns over patient safety and well-being. A staggering revelation has emerged. Nearly 25% of doctors in Ireland are exceeding the European limits on working hours, raising serious alarms about both patient safety and the well-being of healthcare professionals. The Medical Council, which oversees the medical field in Ireland, has expressed deep concerns following the release of new data that highlights this troubling trend. In its 2024 Annual Workforce Intelligence Report, the Medical Council disclosed that there were 20,962 doctors actively practicing in the country last year. Alarmingly, the report indicates that 23.1% of these doctors reported working over 48 hours on average each week, which is a clear violation of the European Working Time Directive, EWTD. This directive is designed to protect workers' health and safety by establishing minimum standards for working hours and mandatory rest periods across the European Union. The specialties most affected by excessive working hours include surgery, where 50.9% of surgeons reported working beyond the 48-hour threshold, and obstetrics and gynecology, with 34.9% of practitioners in that field doing the same. Among those doctors who admitted to working more than 48 hours weekly, a significant 45.6% also indicated that they were involved in direct patient care for over 48 hours each week. This situation raises critical concerns regarding the well-being of doctors and the safety of patients. The report emphasizes that prolonged working hours are linked to higher rates of attrition, increased stress, burnout, and a greater likelihood of being involved in adverse events. For the first time, the report also sought insights from doctors regarding their experiences with patient care and safety. It revealed that just over a quarter, 26.1% of doctors faced challenges in providing adequate care to patients at least once a week, while slightly more than one-third, 33.6%, reported that they never encountered such difficulties. The most frequently mentioned obstacle to delivering sufficient patient care was pressure on workloads, cited by 73% of doctors. This was closely followed by time spent on bureaucracy and administration at 55.1%, and delays in providing care, treatment, and screening at 46.1%. An analysis of the medical register showed that the average age of doctors in Ireland is 43.7 years, with 1 in 5 being 55 years or older. The largest proportion of clinically active doctors is found in general practice, 25.9%, and internal medicine, 23.4%, with surgery accounting for 11.9%. Notably, the majority of these international graduates hail from Pakistan, representing 39.7% of this group, followed by Sudan at 21.3%. In a concerning trend, 1,632 doctors opted to leave the Medical Council's register last year, with most of these departures being voluntary. Among those who withdrew, 58.8%, 603 doctors, expressed a desire to practice medicine abroad, while 14.5%, 149 doctors, indicated they wish to cease practicing altogether. This situation raises important questions. What can be done to improve working conditions for doctors? How can we ensure that patient care does not suffer as a result of overworked medical professionals? We invite you to share your thoughts and opinions in the comments below. Crisis in Irish healthcare. 1 in 4 doctors overworked and leaving for abroad. Ireland's healthcare system is bleeding doctors at an alarming rate, and those who stay are drowning in unsustainable workloads. A bombshell report from the Irish Medical Council reveals that 25% of physicians regularly work over 48 hours weekly, while over 1,000 doctors fled the country in 2024 alone. But here's where it gets controversial. Despite desperate staff shortages, internationally trained doctors face shock. Meanwhile, 352 Irish-trained doctors and 172 EU-UK educated physicians joined the exodus last year. The human cost? Crushing. Nearly half of overworked doctors spend those marathon weeks directly treating patients. 1 in 4 admits struggling weekly to deliver adequate care. No career progression here. I've moved to Australia, revealed a specialist, echoing the 255 specialists and 29 trainees who left Irish medicine entirely. And this is the part most people miss. 149 doctors didn't just switch countries. They abandoned the profession completely. Why the crisis? Medical Council CEO Jancy Cotter points to toxic work brews, illegal overtime, violating EU working time rules, chronic understaffing, and salaries that can't compete globally. These conditions directly harm patient outcomes through stress and burnout, Cotter warns. Yet critics argue Ireland's system has deeper flaws. Why train doctors only to lose them, while rejecting qualified international replacements? Here's the kicker. With 30,000 doctors registered, but only 21,000 practicing, where's the disconnect? The council demands urgent action, better training investments, smarter recruitment, and retention strategies. But will policymakers listen before more lives, both patient and physician, hang in the balance? Now we turn to you. Should Ireland prioritize retaining homegrown talent or streamline foreign doctor integration? Is this a funding issue or a systemic failure to value medical professionals? Share your take below. And if you've experienced this crisis firsthand, we want to hear your story. Support independent journalism, like the 5,000+ readers keeping this content free. consider contributing to sustain crucial reporting on Ireland's healthcare crossroads. Your support matters more than ever.